2, year 3, you start watching these enrollment meetings. They, instead of this check out after 2 minutes, we've changed the structure. People are like pulling up their shirt. Look at my diabetes monitor. And then like, I had this hernia surgery, and like, oh, you don't have to share everything. And so, but they're like really excited.
Yeah.
And those are, I call them milestone moments. You need some like rewards along the way, right? Because the middle gets hard. The beginning, it's excited. When you see a finish line, I'm not sure you're ever really done, but you see the finish line, you're excited. That middle, I call it the desert. That middle, right? The exodus out of Egypt, that was a long 40 years, and they wanted to go back. And the Red Sea was parted, and guess what? The Red Sea closed back up because they probably would have went back to their slavery because it was known and comfortable. But I think if you have those milestones along the way, it keeps you going. It's like, oh, okay, that's we got this far, and we got this far, and we won't go back, right? Mm-hmm. So it's so hard. Change management, I would say, is maybe 50% of this whole challenge.
Yeah, agreed.
It's not to be underestimated, along with figuring out the healthcare dynamics. But the people part is a big deal.
And maybe that's a good first step, is just doing exactly what you did. Get a whiteboard out or a piece of paper and write down all the vendors that are involved in your health plan. Figure out which ones are either with you or against you.
Right.
And I think part of that is asking for contracts that are in place between you and, whatever insurance carrier, network, or PBM, so on and so forth. And if they won't give you the contract or any data, then there's your, first couple red flags.
There you go. Yeah. Are they really working for you? They're doing well.
And then it's diving into the data and figure out, well, what's the biggest need? Is it pharmacy? Is it cancer solutions? Is it MSK solutions? Is it DPC? And then let's start to plug and play from there. Mm-hmm.
I think one of the common mistakes, which is very understandable, which I've made it, and we've all made this mistake, right? But we would sit in management meetings, or there'd be a small group of people saying, this is really broken. This is really frustrated. We understand the problem. We've detached from the problem. We're ready to move forward. Then we get in front of the majority of the workforce, and we act like they've been in all those discussions. They don't even know what we're talking about. Mm-hmm. They realize healthcare is broken, but all those conversations need to happen on a monthly or very regular basis. Are you experiencing this? Are you experiencing surprise bills? Are you experiencing exorbitant bills? Are you experiencing high deductibles, high premiums? Are you frustrated about this?
Yeah.
We're looking at some ways, right? You got to have your group that you're leading through the change. You got to have them begging. I don't know if that's the right word, right? But going up to you and pleading and saying, we need to change. Matt, go faster. We need to change, not I'm resisting the change.
Mm-hmm. Yeah.
But once you have that detach, we had, when we were building, we had a state permit. We were building this DPC. We had them at the picnic, the Christmas party, and gave away teddy bears, and we redecorated an ambulance, which was our mobile clinic. And we're trying to get in front of them. And I've been telling them this for months and months and months. I had people coming to me and say, I know the clinic's not done, but could the clinic start early and see me in a conference room or something? And so we actually did that for like 2 or 3 months based on employees' request, right?
Yeah.
See, I had them asking for change, not pushing them into the change. There's a very big difference in the mindset